People tell us every week that our information has helped save their life. If you agree that this is helpful information, please like, share, and most of all, subscribe, because nothing makes a channel like subscriptions.
So I first met Mark 4 years ago as a patient. He came to me and did not appear to have significant weight to lose like many of my patients. But after we started talking a little bit more about how to manage carbs in his diet, he started doing it and sure enough ended up losing, what was it, 40 pounds?
No, 20. That 40 would put me in a rough area, so yes.
Okay. So Mark is a dentist. I've had a few sessions of hiking with him and with friends out to Yosemite, out to the Pacific Northwest, and a couple of other places, the Red River Gorge in Kentucky. So we've got a lot of experience together. But on one of our hikes, Mark started talking about flossing. And here's the issue. I've had multiple dentists talk to me about flossing, and I just didn't get it. One of my concerns was I felt like my teeth were just really compacted together. And sure enough, I remember being in the dentist's office a couple of times, and both the dentist and the hygienist kept tearing their floss up on my teeth. And so they said, "You're right, you really do have tight teeth." So I felt like that gave me a buy. I didn't have to floss my teeth. And as I said, I've been fussed at a few times. But what's interesting is nobody ever told me why I needed to floss. So I was just using soft picks. Again, a couple of guys fussed at me for using those, said don't do that, but they never said why. I learned why on a mountain in the Pacific Northwest just a week ago. And I asked Mark if he would come on this channel and talk a little bit about that. But before you do, Mark, tell us a little bit more about yourself. You've always been a lifelong learner, and one of the things that impresses me is your interest in learning the science behind what you do.
I've been a dentist just shy of 50 years right now, and I'm still practicing, and I still have a lot of fun doing it. But it was interesting. During COVID, we were forced to shut down for 8 weeks. And so your recommendations for it, I was to stay home for another 3 weeks. So here I am on the 11th week. We have a small farm. I cut every tree down. I moved every rock, and I'm going crazy. I finally said, hey, what is the purpose of my life here? And, we sort of got an answer that maybe I better get back to work. I also asked this other question. And this question, I don't know, it floored me in a way that I even thought of it. But I'm out there on a tractor and I'm saying, what is the root source of the dentist's income? And I'm thinking, and I said, no, none of my mentors through thousands of hours of postgraduate education, but hundreds of mentors, not one of them, not even one, ever asked me that question. And it comes down to any being on earth with teeth that eats is going to collect food between their teeth. And in 24 hours, that food ferments. And when I use the word ferments, everybody thinks champagne and beer, maybe, but I think garbage. And with this garbage issue, it has some detrimental effects in the mouth. And catching that food in there, 24 hours later, it's warm, it's moist, you have trillions of germs, and it's party time. And they ferment. And again, the garbage smells. That's called bad breath. It becomes acidic in 24 hours. And right where the food is caught between the teeth, it gets acidic and eats into the enamel of the tooth, the outer protective shell of the tooth. Now, there are also trillions of germs in your mouth per square inch. This is in your saliva. And your saliva is just part of this gut complex. It starts here at the mouth and it cures through your body. Per square inch, you've got more bacteria here than anywhere else in your body. They're used for pre-digestion of your food. That's the good side of them. But the other bad side of it, beside the garbage, is the acid. Now, the acid eats it into the tooth. These bacteria, trillions of germs, follow this path and have access to the inside of the tooth where the dentin is. Now, left long enough, when you get your cleaning done and you get the x-rays, the dentist can see a shadow between the teeth. A cavity. Hallelujah for the dentist. Because now let's just imagine the tooth is a box. We've got 4 sides in the top, and these 4 sides are all susceptible to a cavity. So we see this little cavity, and maybe the cavity also has a partner adjacent to it on the other side of the other two. Compared to the God-made material, a very poor man-made material. White composite restorations have the lifespan probably of, if we're lucky, 8 to 12, 15 years at the very most. The silver mercury fillings called amalgams have a lifespan depending on size. I would say probably 20. I've seen them 50 and 55 years. Now, they're not pretty at that time, but they do last. However, also the next step, these bacteria form an invisible film on the tooth. It's called plaque. Many of you have heard this term before. It's soft, but it's very tenacious. It sticks very tightly to the teeth. Toothbrush will do it. Flossing removes it. Water pick has a tough time removing it. But this plaque will accumulate the mineral salts from your saliva, and they will build up. And as they build up, you'll feel maybe a roughness to your tongue. This is called tartar or calculus. So the plaque converts to tartar or calculus. But unfortunately, it also subgingival, which means underneath the gums, irritates the gums. And it's sort of like a simple way of saying it'd be like a jagger pushing against the gum down there. It becomes red and inflamed. This is beginning the process. Some of you may have heard of gingivitis, and progresses after decades to periodontitis. Perio means around, odont means tooth, itis means inflammation. Gingivitis means gingiva, which is the gum. Itis means inflammation. So we have contamination of bacteria in the gums. Now, but here's where Ford has enlightened me, and another periodontist, Greg Thompson, he's really enlightened me on this, but we are contaminating our bloodstream. As we do this, you would hope we have one defense mechanism at this point in time, and that is our immune system. And according to these Ford and Greg, this is a challenge to our immune system. Challenging the immune system means the immune system sends out a white blood cell called a T cell, and it surrounds this germ, it destroys it, but in the process, it's like a honeybee protecting its hive. It is also destroyed itself. So we have, through our lives, we have this continuous flow of bacteria between the gum and the tooth, or through the tartar irritating the gum. And again, a very simplified model I'm describing here, but yet this inflammation occurs, we challenge the immune system, maybe not such a good thing. So can we stop it? The answer is probably no. But at the same time, I would also say to you, we can sure slow it down. Personally, I am a person who's lifted light weights all his life, since age 18. And if you would look at me, I would tell you I'm not Arnold Schwarzenegger, and I will never be him. But the fact is, you do define your muscles as you look at them in the shower or in the mirror. Flossing is lifting light weights. You are irritating your gums. As you irritate your gums, they respond, and they respond by getting tougher. They tighten the collar between the gum and the tooth. It's also called the connective tissue attachment. And this is where possibly most dentists don't go there. I'll just tell you that right now. They don't think of it this way, but it's a very logical sequence of events right here. And either Ford or Greg at one time mentioned that they had done a study years ago where 100 patients who passed away of Alzheimer's, they sectioned the plaque in their brain and they put it under an electron microscope, and they found that 100%, that's 100 of 100 people, had bacteria common to the mouth in that plaque. Recently, they've identified maybe possibly another study, but it's Streptococcus gingivalis. But my point is, there's more to it. This is literally the filthiest place of our body. It's someplace that needs to be respected and taken care of. So I've given you 4 possible reasons why you might want to keep this area clean. Now, I would also suggest to you is that there's so many different gimmicks in our profession. And years ago, it was a $6 billion industry. I'm sure it's more, but from electric brushes, which I really respect, I think that it's been proven that they are 20% more effective than a manual brush. I think that's really a good thing. Until recently, with one of my mentors, John Coyce, mentioned that it's an adjunct. It's an add-on, but does not take the place of flossing. You've got to be able to remove the plaque. Now, the water pick will remove the food. Maybe it doesn't do such a good job with the plaque itself. So that's when it's in its soft stage. But I am a huge advocate of flossing. And when my patients are in the chair and I'm doing a hygiene check, I try to describe them as one of 3 car models, for maybe a Chevrolet, Cadillac, a Mercedes, or a Ferrari. And it's amazing how many young people come in. I'm saying, listen, you're a puzzle to me. I look at you and I see that dinged up Ferrari in here, but yet I look at your physical appearance. Looks like you're in shape. You're an athlete. I don't get it because there's just one piece missing. You are a Ferrari that's pulling into Walmart and getting their oil changes. And they look at me and I said, yes, this is flossing. Actually, flossing 2 to 4 times a day is the Ferrari oil and grease. This is a Ferrari shop because I'm giving you advice. So am I obsessive about this? The answer is yes, I am obsessive. But I will ask you a question. Are you worth being obsessive about? John Coyce mentions that our smile is 1/3 of our looks. In a woman, the beauty of the woman. But yet I see so many young people giving this asset away. It doesn't make sense. If you're willing to take care of your body, have proper diet, do the exercise, doing everything you can to stay healthy, why not add this one little tidbit that takes it over the edge? And I think flossing is it for sure. To me, it makes sense. I've watched it with my patients and I give them this talk all the time. It's amazing what we see as they grow through the years. It becomes like a bad habit. It's something you can't do without. It actually feels good. Matter of fact, I always liken it to wearing dirty socks out of the house. You can't stand it anymore. You got to do this flossing and it just feels good. A lot of people, especially when they're young, they would be super alarmed that they would scratch their arms. When they brush and floss their teeth, they see bleeding. It's no big deal. It's normal. Frankly, it's not normal. This is a sign of gingivitis and some issues going on in your mouth. My goal with my patients is prevention, and we've taken it a step further with this model of access of the bacteria getting into your bloodstream, and Ford really and Greg Coffey really made me very aware of that, and I think I'm on the right track. So this is the end of video number 1. The next video will be on technique of flossing.